also contribute as well.
How is technology impacting and supporting health and wellness right now?
So I think I should take that one to begin with. I think it's pretty obvious that the growth and adoption of technology in this space is absolutely staggering. So I kind of think about times when people were quantitative selfers and they would walk around with a little step counter or something funky, and that kind of developed into people wearing cool jawbones and then people being really interested in sleep tracking by putting their iPhone under their mattress or something of that nature. And that's great, right? And there's data and more devices are getting cheaper, and we're sort of submerged in all this information, and that is enabling a lot of things to come about. There's 100,000 health apps out there right now. I mean, I even read the other day that Apple Watch is almost selling 2-to-1 all Swiss watch manufacturers together. So devices are there, data's there. I think part of the challenge of this, and I'm talking from a sort of commercial perspective as a businessman here, is there's a tremendous amount of opportunity, loads of innovation, and lots of tools to work with there. But the key is, how do we actually deliver something that's of value? So once I know how much I sleep, or I know what my resting heart rate is what can I actually do with that that's useful? So it's really exciting. I think it's not just wearables, it's even sort of incidental technology developments like the smart TV. Would there be services like Fit, which is FIIT, or even Peloton, various different services which are coming up and which are really sort of deputizing where gyms are shut down at the minute to pick up personal training sessions at home. So all of these things are sort of coming around because technology for me it's impact. It's more of an enabler that enables other things to happen on top of it. And the challenge is delivering value rather than just delivering wearables, because I could have a Peloton subscription, I could have an Apple Watch. But if I don't actually engage and do something with those things, it's not really any use to anybody. It's not going to improve health for the sake of it.
I totally agree. I mean, how many of us do have these gizmos but don't actually use them well? We may not be getting value from it. I mean, my wife's birthday is next month and she's asked for an Apple Watch, so that's what she's getting. Technology is a double-edged sword, really. I think we're at a very interesting place in humanity, that technology is becoming much, much more integrated into our everyday being. Not only can we not get away from it very easily, but we're becoming quite dependent on it. And some of that's good and some of that's not so good. So if I talk about our Power app and how we've seen an integration of that in the last, say, 12 months, what we've seen is built into Power is 440 clinically based behavioral plans, which makes us kind of different to other digital tech out there that are put together by a team of clinical psychologists who support Google Ireland. What we've seen when people go in and fill out the questions, and I saw somebody popped up there about in the chat about data. Data is super important, but it's also how do you use it? So how do you measure your well-being and then do something about it? What we found is most people go straight to the mind questions, and of course we saw a double on that, so it went up by 50%. But what we saw consistently over the last year is people wanting to track their activity. They were struggling with doing exercise from home. So that went up about 400%. The food, it's built on 6 pillars. The food and sleep were the next 2 biggest. So what they were doing was they were using the questionnaires to find out how they were going and then looking for plans to kind of get them going. So it is about what you were saying there about using the value. I guess if you want to look at the dark side of technology, what I saw at the very beginning of COVID was people were gorging themselves on information about COVID on social media, and most of it wasn't correct and accurate, and that was really starting to affect their mental health. Was kind of just appetite of information on social media. They couldn't get away from it. They were like addicted to it. So I actually tell people don't look at the news. It's very, very negative. It's very, very repetitive. Maybe look at it once and then that's it. So there is a dark side to technology, but there's also a very useful and integrated way of using it. But people got to get smart about it, right?
Absolutely. So next question. Looking forward, how can companies ensure they're future-proofing their business to support health and wellness?
I think that one is directed at me again, so I'm taking up a lot of time. Sorry, folks. Got to give the rest of the panel a bit of action. So I'll be very, very quickly to future-proof, really. And again, I come from a very positive mindset. I'm really enjoying seeing people get more interested in their well-being, right, and prioritizing it, or at least making it. Having these sessions, for example, is super important. So I think to future-proof, companies really need to get it on the agenda. It really needs to be part of the senior management team meetings on a regular basis. They need to lead from the front, right? Because if they put it on the agenda from the top, it'll start to get on the agenda lower down in team meetings, to have it in there so they're actually talking about it. This is after COVID goes away. They need to put some decent budgets beside it now because, it's super important. They need to check in with their people to see, where are they at by doing surveys, regular check-ins. In my book, I talk about WIN, which is the name of the book, but what's important now? That's what we need to keep on checking in. What's important now at different stages, and there will be different things. What we do for organizations, and organizations should be doing this or have this in place, is a calendar of events throughout the year. So plan ahead. Make sure you're doing some well-being on a regular basis, once a month, whether it's talks or workshops or hearing from senior leaders about what they're doing, and including that fun events. A lot of it, this is quite serious and heavy. So you actually kind of get back to enjoying some stuff. And we saw that when pandemic first hit, there was lots of coffee mornings and lots of Friday drinks and quizzes. They kind of petered off. Actually, it's now time to bring them back because we're still in lockdown. And finally, just super, super important always is comms. Good comms to help people prioritize and remember that they have responsibility to take care of their well-being.
If I can just chime in with something there, I think that part of this is in terms of future-proofing. I think a lot of health and well-being in the corporate setting has been an add-on, something that sits on the side, something that is sort of a vanilla perk that a handful of people might tap into depending on what it is. And I think some of the more forward-thinking companies tend to think of it slightly differently. And then they kind of think about how they can embed the health and well-being and productivity of their staff as a sort of cultural pillar. And in order to do that, it actually requires more thinking, more sort of, strategizing as to how they can entwine that into what the day-to-day lives of their people is about, and maintaining health across the board. And then it's not necessarily about thinking about future-proofing. It's really adapting as you go to make sure that the services and products and things that people are using in your workplace are still tied to the culture of what the company's trying to achieve.
Yeah, agree completely. And I think you're right. A lot of organizations have paid lip service to health and well-being. And we've seen a lot of the kind of, someone I think referred to them as the culture plasters, the short term, right, yeah, we've got a ping pong table, we're going to do this, we've got yoga on Friday. And that's great, don't get me wrong, that's fantastic, but it's not, as you say, ingrained within the essence of what health and well-being for the organisation is necessarily about. And yeah, I think it's really important that it's not just paying lip service to it, and it is taken seriously.
Yeah, I've gone to the days where sort of desktop yoga once a year would do it in terms of the sort of well-being front. I think it's got to be much more holistic than that. And, Jason touched upon it with the fun element. I do a lot of public speaking with corporates, and people are so stuffy. People are just so coming at this angle where actually they try and present well-being and health and wellness as not being a fun topic to talk about. It can be engaging. It can, be fun. I've seen a lot of innovative startups, particularly embracing like team building exercises into their week. I think that's great. I think the sort of stuff that Ian does at Scooch, I think just sounds fantastic. A way of giving value to employers, embedding that culture so it's not just, a cactus on your desk and a bit of desktop yoga. It needs to go much further than that.
So final question to our panelists. What's the one thing that you would encourage companies to adopt today to spread the message about the importance of health and wellness?
I think, along with what we've discussed earlier, I would encourage every business to put it front and centre of their kind of programme of activity moving forward if they want to reduce the cost of absenteeism and presenteeism, to retain their staff, ensure that it's part of the agenda and take it seriously.
I'll just follow on there if I can. Companies cannot afford to not have a well-being strategy anymore. That's the bottom line. They need to invest in it proactively. And it's not just, to touch on something we talked about earlier, it's not just getting an external provider in. It's got to be a mix. There's got to be an internal surge, a ground root surge. And actually what I've found during COVID is when companies put out a shout for, does anybody want to be a well-being ambassador or mental health first aider? They get lots of people signing up. So now's the time actually to put it out internally to ask, is anybody willing to join a task force or a working group to grow this well-being strategy? And therefore, just to carry on from what Sarah's saying, that you get it on the agenda, because now there's a working group that has to report back. You get investment, you build a business case to grow that well-being strategy. And I'm hoping, I really, really am hoping, once COVID goes away, and it will go away, is the dialogue and the dial will shift from not just talking about supporting well-being, but enhancing well-being, right? Because they're not the same thing. We're talking a lot about support at the moment because we need it. And one thing I've noticed with COVID is it's such a human experience. Like nearly everybody in the globe is being touched by it, and therefore everybody within a business is being touched by it, from the senior exec CEO right down to the new person who's walked in the door. So it's given everybody permission to talk about it, which is a great start. But then when it goes away, we need to keep it on the agenda to talk about enhancing well-being, and that then leads to performance. If I pick up on what Ian was saying, for example, if we're physically fit, we're mentally fit, and we'll enhance the culture of any organization because of our fitness.